Is it normal to have discharge after implantation?
Hello and welcome. In this video, we will be discussing whether it's normal to experience discharge after implantation. We will cover what implantation is, the various types of discharge you may experience, and when to consult a healthcare professional.
What is implantation?
Implantation occurs when a fertilized egg attaches itself to the lining of the uterus. This is an essential step in the process of pregnancy, as it allows the developing embryo to receive nutrients and oxygen from the mother. Implantation usually takes place about 6 to 10 days after conception.
Is discharge after implantation normal?
Yes, it is normal to experience some discharge after implantation. There are two main types of discharge that can be observed during this time. 1. Implantation bleeding. This is a light spotting or bleeding that occurs when the fertilized egg attaches to the uterine lining. It's typically a pinkish or brownish color and is much lighter than a regular period. Implantation bleeding is experienced by about 25 to 30% of women and is completely normal. 2. Cervical mucus. During early pregnancy, your body produces more cervical mucus to help protect the developing embryo. This increased mucus production can cause an increase in vaginal discharge, which is typically clear, white, or pale yellow and has a mild odor.
When should I be concerned about discharge after implantation?
While some discharge is normal after implantation, there are instances when it can indicate a potential issue. You should consult a healthcare professional if you experience any of the following. Heavy bleeding. If you're experiencing heavy bleeding or severe pain, it could be a sign of a problem, such as a miscarriage or an ectopic pregnancy. Foul-smelling discharge. If your discharge has a strong, foul odor, it may be a sign of an infection. Green or yellow discharge. This type of discharge, especially if accompanied by itching or burning, could indicate an infection. Fever or chills. If you have a fever, chills, or other signs of infection along with abnormal discharge, you should contact a healthcare professional. In conclusion, it is normal to have some discharge after implantation, including light bleeding or an increase in cervical mucus. However, if you experience heavy bleeding, foul-smelling discharge, or other concerning symptoms, it's essential to consult a healthcare professional. Remember that every individual's experience may be different, and it's always best to seek personalized advice from a qualified healthcare provider.